navigating modern manhood, exploring what it means to be a father, a husband, and a man in the 21st century. Now with your hosts, Scott and David. Hey Scott, how are you today?
I'm good, thanks, David. How are you?
I'm all right. Just got back from the doctor, actually. So if I seem a little bit puffed, I had one of those moments where I went to pick up some, in the e-card system we have, maybe you have it in Slovenia as well, but you can get your prescription put on your card. And so my card ran out. The cardiologist in this case said, all right, come on in. They said, we've got free time. Hey, do you want to do an EKG? How about some blood work? So it reminded me, and I got to see my doctor. I'll still keep taking medication, but it reminded me of hereditary. The fact that all of us, men especially, we are not invincible. So that's been my last hour or so. Scott, what about you?
Mate, I'm looking after the kids and trying not to pass on my things to them. But as you say, hereditary, sometimes it locks you in, and we get a choice to change that when we look after ourselves. So
Yeah,
I'm sure that's one thing you're following, and that hence going to the doctor, right, and getting the EKG.
Yeah. Well, I mean, for those out there, it was about 8 months ago when I first started to feel. Actually, my wife had an episode of stress and a blood and a heart issue, and I thought, well, let's get a machine for home. And I started to take my measurements and started to see that my measurements were really high. I thought, well, maybe I ought to go to the doctor. And lo and behold, the doctor helped me to see that, in fact, yes, I have a blood pressure issue as well. And speaking to my dad, he's had one from his mid-30s, and my grandfather, his father, also had blood pressure issues. And my father takes medication. My grandfather's now passed. He did live till nearly 91. So I hope that's helpful to have. But at the same time, it was a moment when I really had to realize, okay, I have to take some steps towards helping myself here. I'm in my mid-40s, and honestly, now it could be an occasion where I need to be on medication, perhaps blood pressure medication for the rest of my life. But of course, looking at other factors as well. So another relative of mine said, yep, it's in our family. I tried everything to change it, lifestyle, no alcohol, diet, the whole thing. But in the end, she said, you just sometimes have to take the medication. And so that's been my reality in this moment. Yeah.
Yeah, cool. And I do remember as well a couple of months ago that you were doing your meditation and actually had changed your lifestyle and had managed to drop it as well. So for sure, I'm not a medicinal person in terms of understanding medicine, but yeah, look, my mum and dad, both sides of their families have had heart issues, high blood pressure, cholesterol, all that sort of level. And the evidence that I've had when I was young, I say young, hopefully I still am. I like to think I still am. I certainly play up like I still am. But yeah, it's sort of late 20s. I had my blood check up and it was, you've got high cholesterol, and come back and see me in 3 weeks. We'll check it again. What I managed to do is just literally change my diet, cut out all the unhealthy foods, and went straight back down into the normal levels, actually well below normal levels. It was just a lifestyle factor which contributed to going up. So
yeah,
for sure.
What did you cut out, Scott?
Yeah, so what I cut out is it was literally I was back in Oz at that time, so I cut out the meat pie and chips, the soft drinks, all the sort of fast food. Started eating healthy, and bringing lunches to work and everything else like that. And it was just a conscious choice. And I also increased my activity. So I was always been very active in the surf and playing rugby. I had noticed that I sort of dropped off in that sense, being in the off season, and then I was like, no, I'm back into it. So it was a combination of becoming active again and then cutting out the unhealthy foods. It was that conscious choice. It was like, I really feel like pie and chips. Everyone else is doing it. Do I do it to fit in? And I was like, no, actually, I'm going to do the healthy thing for myself, my body, and to see it. And look, for sure, I can see it in my whole family, even, outside of the family, but within the family, there's certain things that we can all improve. And with the changes, it drops, right? I know with my dad, his cholesterol levels were so high that he's actually been told to start eating cholesterol because he's managed to cut everything out. So now he's back on the full cream to bring it back up.
Oh wow! So he dropped right down as a result of a diet change as well.
Yeah.
Oh,
So
so
interesting thing to play with, but yeah, for sure, it's yeah,
yeah,
hereditary things. Even when they're there, it's knowing that, as you said, I think you said your cousin or your auntie in the family, um, you know that it's there, but it doesn't mean it has to control your life. So you
yeah,
can manage it. It's not something that you just have to accept that, okay, I'm going to be on the tablets. I don't have to do anything because the tablets will look after me. It's actually no. If you want to have a good quality of life, then
yeah.
you go and put the work in. And I think that's where both of us as mentors
Mm.
and coaches, we can help people, not just on the medicinal side, but with their emotions, with their thoughts, and spiritual levels and energetical levels as well.
Yeah, yeah, absolutely. I mean, I know at that time I was, facing some personal challenges that certainly contributed to that sense of anxiety and overwhelm. As those challenges come again this year, I'm seeing that I'm also facing it in a very different way. So you're right; it's the mental mindset behind our choices as well. And what looms for us? So I guess for you, you mentioned your parents, cholesterol, high blood pressure. So it sort of looms over you. I know my dad had prostate cancer in his mid 50s. He's still around, which is great. But that
Yep.
also looms large for me in that sense that I now every year here in Austria get a medical, and it's free through the insurance that I have. Is it the same in Slovenia where you can have a yearly checkup?
I believe there are. I haven't hit the age threshold yet, but certainly prostate cancer is something I think about because my grandparents have had it, and my father as well. So, and he's just
Mhm.
recently gone through treatment for that.
Okay.
So yeah, it's conscious and it's on my mind, and
Mm.
yeah, I know that you can get the help here, whether it's free or not. I'm not 100% certain, but it's
Yeah.
something that I will be looking into as time progresses.
Yeah. I've passed the 40 threshold. You haven't yet, if I understand. So
I got one more year. I'm
one more
holding on to
year.
that one more
Yeah.
year.
Yeah. Yeah. And I mean, for those men watching, take it seriously. I think that's the message that we want to share today is that our health is important, and we were both discussing that idea that we feel invincible in your teens, in your 20s. You can go out, you can enjoy yourself, and then the next day you can hit a full day of work and not have any issues. But the further on into life we get, the more the body breaks down, the more we have to maintain a certain level of health and a rhythm with our health as well. So, is there anything I know you're playing rugby at the national level with
Yeah.
Slovenia, Scott, but what else are you doing maybe on a daily basis that is, helpful for you?
So daily basis, one of the beautiful things about having dogs is they get you out of the house. So at a bare minimum, my wife and I, Jasmina and I, we go for at least an hour's walk with the dogs. So
Okay.
it's physical activity, and people say, walking at half an hour to an hour a day is the best health you can get. It's fresh air. We're out in the environment. We're out in the bush. We're connecting with nature. So it's a real
Mm.
peaceful de-stress also from being around in the constant environment, especially around the house. And being a father yourself, parenthood, sometimes we have those complications. We do get stressed, and we need to learn to step away and non-react so that we
Mm.
can respond and be better role models for our kids.
Yeah.
So yeah, I also bike ride as well.
Mhm.
I try and stay fit when it's raining. I got the stationary one and put 45 minutes to an hour on that.
Mm.
But yeah, it's more just trying to stay active to keep going. And a person that we know, he says, I go to the gym so that I can stay fit and healthy so that when my grandkids are around, I can run around with them. And
Yeah.
this is one of the things that I noticed that when I did stop playing rugby during the
Mhm.
COVID period,
Mm.
all my joints and muscles and everything else started to dwindle and collapse. You could feel the pain coming back around. It's because the support structures weren't there. So
Mm.
if we can support our physical body, we can also support our mental health and our emotional health as well.
Yeah.
So it's the same thing. Like you sit on the couch, you can go in the head loops and spiral, and then you get depressed. You're not doing anything for yourself. And as I mentioned before, it comes down to choice. If we have the choice, we can choose to get up and move. We can choose to do things, and as a
Mhm.
positive consequence, you end up feeling good about yourself. And that's one of the things that I do for myself is rugby is that connection, that community, the interaction that I have with the fellas, which I don't get because I work from home. I don't really get that interaction. I don't get to get out of the house. So it's a choice that I do make to get out. And so I use the
Yeah.
dogs. Jazz and I connect on the walk together. I go out and have that you know, male interaction with the boys.
Mhm.
Let off
Mhm.
that steam and the testosterone and everything else.
Mhm.
Also, on the other side, even though it is a physical impact sport, I get to use my aggression in a positive way. So
Mm.
if I've got something pent up inside and I need to get it out, I'm looking for an outlet.
Yeah.
Doing the tackle bags, pushing myself in the running to keep my fitness up.
Mm.
It's a point where I can use it in a conscious way, and I don't go to the point where it's an addiction.
Yeah.
It's because when it can become an addiction, then you can go too far, and then it can be detrimental to your health. So it's about finding the balance.
Yeah, yeah, that's great. That's great. I've heard it called anger energy. Anger energy. So, as you say, it can feel like aggression, but in that moment, it's that utilization of your testosterone, your cortisol, the stress, the letting it out, the physical movement of that emotion, whatever that is for you as well. Yeah.
Yeah, and there's nothing better than when you know that you've put the work in, you've done the training, and you've got your technique right and everything, and you use that anger energy, as you said,
Mm,
and you use it well, not to hurt somebody or anything else like that, but to do your job well. You get
yeah.
that huge dopamine hit, and that dopamine hit runs not just in that moment for quite a period afterwards. So it's
Mm,
beneficial for a long term thing, even though probably for my body, playing rugby is not the best idea for a long term down the
sure.
avenue. So
Yeah.
it's about putting that training in and finding that balance.
Yeah. Well, while you're still young, you might as well do it for a few more seasons and then see how you feel, I guess, at each stage of life,
Yeah,
as well.
absolutely.
Yeah.
Yeah, and I think one of the things that also pushed me back in was not only that I wanted to do it for myself. However, the kids, they saw the photos, they saw all my rugby gear and everything else. Like, Daddy, I want you to go play rugby so I can see it. So they have seen me play. It's just obviously not in their memory bank that they can recall. So
Yeah.
it's a point as well that if I show them and I model them, that if there's
Yeah.
something that you're interested in, you can go and do it. So it's like Julian's very interested in basketball and soccer at the moment. So
Mhm.
we're empowering him to go and do that and to train. So we bought the basketball rim. I built soccer
Mhm.
goals outside that we can play in the backyard, and it's about feeding that energy, feeding that excitement, and that sense of
Yeah.
wonder. Because
Yeah.
when you've got that sense of wonder and that dopamine hit, and it just
Mhm.
brings everything up in life. It doesn't mean you disregard the sadness and everything else that you might feel.
Yeah.
It's how do we work with them and motivate ourselves to keep progressing in life so that we don't stay stuck.
Yeah. Wonderful. Wow. That's great. And I think in a future episode, we ought to talk about how to inspire our kids, how to inspire that next generation. As you say, goals, equipment is one thing, but I'm sure you've got some deeper insights that we can share in another episode. So great.
Absolutely.
Yeah.
And I think I might just ask you one thing too before we go is
Sure.
you're talking about inspiration. So in hereditary, so it's down your line, your father lineage of prostate cancer, you can also inspire your boys as well, right? Of how
Mm,
you handle it, how you look after yourself. So
yeah.
what are you doing that for yourself and your boys?
Yeah. Well, I mean, for sure, right now, I don't drink alcohol, or at least limited alcohol. Certainly not anything high, not even on a daily basis. The more research I'm seeing coming out now, Andrew Huberman talked about the fact that even just occasional drinking leads to spikes in anxiety. So I think there's
Mm,
something in that to explore. Looking after my health, as you said, and it's about regular checkups. So today, like I said, I was a bit stressed coming here, but the doctor said, right, let's do an EKG. Great. Do a blood test. Great. See you in a few weeks. But so far, I think, from what I see, remain on the medication. So don't leave it for, 3 years. Go and do it. It's like we should visit the dentist every 6 months for a clean so that our mouth hygiene is good. It's the same with
mm,
our mental hygiene. Being in rugby, being in sports, being in groups of community can really help. So I think it's a combination of factors that I'm trying to look at as well. And one of the main things is that annual PSA test, it's called. They can do a blood test now and
yep.
determine your level. And then every couple of years, having a digital exam with a doctor, of course. So I've had one of those before. Yes, it's uncomfortable, but it's important. And the size of your prostate and keeping that in check, and also looking for other signs. There are signs if it's starting to enlarge in your urinary flow, for instance. So having an awareness of your body, and when something doesn't feel normal, get it checked out. I think that
Yeah,
for you and me in
absolutely.
our generation, compared to, the men of the boomer, the next generation, some of them are really reticent to go to the doctor.
Yeah, and I think that comes from it almost being health was a taboo subject.
Yeah,
It was very separate. There's women's problems, that's men's problems, and we steer clear
yeah,
of it. And it wasn't something that's discussed, okay, not over the dinner table, but it's not discussed as a family. It's only
exactly.
when there was a problem, then it
Yeah,
got discussed.
yeah,
And I think that's one of the things, especially nowadays, a lot more people are open about it, especially people trying for kids. If
yeah,
I go back 10, 15 years ago, it was all very hush hush. If somebody did potentially have trouble or have a miscarriage or anything else like that, it was all like hush hush. Whereas now, a lot of people, a lot of healing for them is actually to discuss it and
yeah,
for people to know that they're not alone. And I
yeah.
think that's one of the most important things is we can communicate what's going on with us and have discretion of, situational awareness of who you disclose and what and to.
Mm,
But actually having it as a topic that we can discuss health, whether what levels, depending on where you are comfortable with who's around you,
mhm.
is to have that open, frank discussion and make people feel that they're not alone.
Yeah. Yeah, and that it's not a problem to have a medical issue or a concern, It's better
No,
to for me to have half a blood pressure tablet now that maybe keeps my blood pressure down for a longer period of time, and at some point it may have again, an episode or an issue, but hopefully I can mitigate those, circumstances as well, and I think the what we're aiming for with this podcast series is really about being modern men, and modern men say, cool, I have something that I need to go check, not
absolutely.
at the point where I'm in an ambulance on the way to get checked, but early prevention, early adjustment to our lifestyles, like with cholesterol or blood pressure, or just monitoring our bodies and being more aware, holistically
Absolutely.
aware of what we're trying to do, to model that for our kids too. As you
Yeah.
said, being around for the grandkids, being healthy, being able to live with them, enjoy them, and not be grandpa in the corner, I think is a nice idea. A nice idea.
Absolutely. Yeah. Because everyone's got that feeling. I want to be the cool dad. I want to be the active dad. I want to do this and that and the other. And as you said, if you're the grandpa in the corner, you can't do that. So,
Yeah.
we've only got one skin suit. We've got to look after it. And rather than let something develop, if you feel something's wrong, go get it checked out.
Yeah. Great. Thanks for joining us today, Scott. And for all those watching, take care.
Yeah. Absolutely. Thank you.
This has been another episode of Modern Manhood. And if you've enjoyed this episode, please click to subscribe and make sure you stay connected. We are navigating modern manhood. Join Scott and David next time.